non-citizens. In California, Governor Newsom, it's not cutting off all non-citizens, but he's capping that. I wondered, there are two of you from California. One, if you support that. Two, if states girding for this bill should be reducing the number of non-citizens, preparing for what Republicans might do here, who are eligible for Medicaid. I know they're going after SNAP too, but just on the Medicaid part.
Yeah, let's be very clear. I want the Vice Chair to speak, and actually Dr. Schreier as well. But let's be very clear. No federal Medicaid dollars are going to provide health care to individuals who are undocumented. I think you'll accept that, and that is a current fact. Some states have chosen. Some states have said, including Washington and the state of California, have chosen to provide health care to everyone because, mind you, people will get health care. We can help choose, and our state leaders have said, we would prefer you have health care than you show up to an emergency room and provide the most expensive way to provide care through that process. And so our state leaders have independently made that decision. Now, the Trump administration and House Republicans are choosing to penalize those states by reducing their FMAP funding, their health care funding. What that is going to do is it's going to hurt the entire system, including mostly rural health care in California and Washington and in other states. Hospitals will close because of that lowered FMAP contribution. So if that's the ultimate goal of what House Republicans want, is they want less access to care, they want people less healthy, they want people to drive in rural America to drive further for their health care options, then they should be very clear about that. And maybe they are being clear by having a 10 p.m. budget hearing, a 27-hour markup, by the way, where health care started at 2 a.m., 3 a.m., and having the Rules Committee start at 1 a.m., it sure seems to me that they don't want to talk about taking health care from people. So maybe that's the broader point here. The state of California and the legislature will make decisions under their purview, and we wish them well. They don't consult us when they make these decisions. But I applaud their ability to say, let's try to provide health care in a more efficient way, using state funds to do that, rather than clog up our emergency rooms that impacts everybody.
Sure, thank you. Chairman Aguilar is right. None of the federal Medicaid dollars are going to undocumented aliens. And then looking at Donald Trump's comments to the Republican conference this morning as reported, I don't think the president has read the bill. He specifically said, don't F around with Medicaid. The bulk of their bill messes around with Medicaid. It's going to basically have this massive cut to Medicaid. So I don't know exactly what the president is thinking. The entire bill a lot of it is just messing around with Medicaid. So I urge the president to actually read the bill.
I will reiterate these points. Not a single federal tax dollar is spent on Medicaid for people here without documentation. From a purely pragmatic standpoint, we all just talked about the fact that care is going to be given somewhere. And if it's given in the emergency room, it's most expensive. We all pay for it. We pay for it with our economy. We pay for it with a sick population. And we pay for it when those emergency rooms or labor and delivery or the hospitals themselves close. There's a pragmatic answer.
Thank you. Have a good day.